and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Getting older is not for sissies. That's what one of my patients says. And it's funny, but it's true. Live long enough and you'll get arthritis, skin cancer, probably one of the common chronic diseases like CHF, COPD, diabetes. At All County Healthcare, we teach you how to manage your disease. We make sure you know how to take your medications and how to recognize signs and symptoms before requiring hospitalization, no matter how many visits it takes. You didn't move to Florida to be sick. You moved here to enjoy the rest of your life. And that's exactly what our team of nurses, therapists, and aides at All County Healthcare help you do.
The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome. My name is Patty Villa, and I am hosting tonight for David DePino, You and Your Doctor. This show is sponsored by All County Healthcare, and you can reach them at 1-888-717-7170, and you can ask for Maddie Kaplan. If you want to follow us, you can go to our Facebook page and watch us streaming Facebook Live. And you can listen to us on 95.3 or 1470 FM. Today we have Dr. David Perloff, who is with Florida Medical Center. He is a cardiologist. Welcome, Dr. Perloff.
Thank you.
The first thing I want to start with is AFib. We see all these AFib commercials all the time on television. Some people understand what that is. Some people don't. Some people are confused. Can you tell us a little bit so we can clear up for everyone that's hearing us and watching us what AFib is all about?
Sure. Atrial fibrillation is a distinct arrhythmia. It's an abnormal rhythm that we see. It is the most common sustained arrhythmia we see. And what ends up happening is that the normal conduction pathway of the atrium is that electrical activity starts in the high right atrium and spreads across the rest of the atrium and then down into the ventricles. In atrial fibrillation, there's sort of chaotic, discoordinated activity of the atrium electrically. And so it sort of quivers and doesn't contract normally, which ends up leading to other problems associated with atrial fibrillation. So it's an irregularly irregular rhythm that often is quite a bit faster than normal as well. So it's a problem, and it makes people feel uncomfortable.
And why is AFib on the rise?
So AFib is actually a disease of the elderly, really. We do see younger folks with AFib, but for the most part, AFib is a disease that increases in its frequency exponentially as we get older, to the point where if you take just the average individual over the age of 80, 10% of them have AFib. That's how common it is. It's a very common arrhythmia. Now, we do see some people who are younger with AFib, but again, it's really a disease of the elderly. And what's happening is we've got an increasing aging population, right? So with the baby boomers now retiring and moving into an older age group, we've got this very large older population, and the fact is that we've got more people living nowadays with sicker hearts. In the old days, these people would not be able to live as long. We now have modern medical care, and we're able to keep these people living reasonably healthy. But along with that goes heart disease and heart failure and other things like that, and those diseases then predispose patients to atrial fibrillation as well.
Now, let me ask you, how does a person know they have it? Because I have a friend that's in her mid-60s, and she has told me several times that she thinks that she has AFib, even though she has not been to see a doctor.
So that's interesting.
Just because she has, the palpitation, she has, the symptoms, and she's like, I really need to get to a doctor because I think I have AFib.
Sure.
So how does a person know maybe, the symptoms for it?
So the first thing I would tell your friend is to definitely get checked. It's almost impossible to really tell that you have atrial fibrillation, unless, of course, you're a healthcare professional, by just what you feel. In fact, I have patients who have atrial fibrillation and also have other rhythm disturbances, and we sometimes have difficulty figuring out what's actually AFib and what's not. AFib is a distinct arrhythmia, and people can get other rhythm issues as well. So the best way to find it out is to go to the doctor and actually get a monitor. We put people on 24-hour monitors. We'll put them sometimes on week-long monitors, even up to 30-day monitors. And sometimes we have even longer-term monitors that we implant that can last up to 2 years in order to catch rhythms that are difficult to catch. What most people feel when they have AFib is palpitations. They feel a sensation that their heart is beating irregularly or rapidly. And again, one of the best things to do is to get a monitor, and once I see it, I can really tell you whether it's AFib or some other arrhythmia. The interesting thing is, though, and this is kind of a little bothersome, I guess, to a lot of people, is that the majority of people who are older who get atrial fibrillation don't actually feel it. So I'll often have people come into my office for an exam. Their doctor sent them, for something different because they were maybe having chest pains or had hypertension or something else. And I will check their pulse. It will be irregular. We'll get an EKG, and they'll be in atrial fibrillation without even knowing it.
How do you treat AFib?
So AFib has really two separate and distinct issues that need to be managed. The first issue we have to manage is deciding whether we're going to do rate control or rhythm control. Okay, so let me explain what that means. Like I explained before, atrial fibrillation is a rapid rhythm, and the problem is that the ventricles are being bombarded by this very chaotic electrical activity. And so one of the things that we can do is to basically slow down the amount of impulses that can get down into the ventricles and slow down the heart rate so that it's at a normal rate. The other thing we can do is to try to get people back into a normal rhythm, what we call sinus rhythm. And that often involves cardioversion, which is usually done by electrical energy. What we do is we put the patient to sleep temporarily. We have medications that put them out for maybe, a minute or two, and then we shock them back into a normal rhythm and wake them back up, and they're fine. But then in order to keep them in that rhythm, we need to give them medications to keep the heart rhythm normal, or we will go on to something called ablation. That's another procedure where we put a catheter or a tube into the heart and basically use electrical energy, or sometimes we use radio frequency ablation, or sometimes we use cryoablation or freezing energy. And we essentially burn out the electrical pathway that's leading to that rhythm. So that the idea here is to actually cure that rhythm so that it doesn't occur anymore. And that has it's a good procedure. It's not a perfect procedure, but it's a good procedure. So the number one question you have when you're treating AFib is, do we do rate control or do we do rhythm control? The second issue that you need to deal with is that atrial fibrillation is also associated with stroke. So if you look epidemiologically, we've known for years that people who have atrial fibrillation, what we call non-valvular atrial fibrillation, are at 5 times increased risk of stroke of the general population. And that's because when you have this chaotic electrical activity of the atrium, it doesn't pump normally. So that blood kind of sits in the left atrium and doesn't get transported well into the ventricle. So because this blood is sitting around, you can get a little clot that forms within the left atrial appendage, and that clot can break off and travel through the bloodstream up into the brain and cause stroke. Stroke is obviously devastating. It's a huge cause of disability. And so the treatment, or let me say the prevention of stroke in atrial fibrillation is really done by blood thinners. So there's some older blood thinners known as warfarin or Coumadin. And then there's newer blood thinners, what we call the direct oral anticoagulants, and we have several of those. And those are very, very active and effective medications to prevent stroke. And then the final thing is there's a new procedure out called a Watchman device, where we actually place over the left atrial appendage a little umbrella. We go into the heart, not during surgery, it's during a procedure. We go in with a catheter and feed over this umbrella device into the direct area where those clots occur, and basically exclude off that area so that it can't allow a clot out. And that's a good procedure for some people who have atrial fibrillation, but certainly not everybody. So the two questions we deal with AFib are, number one, rate control versus rhythm control, and then how we're going to accomplish that. And then the second question is, how are we going to accomplish stroke prevention?
Right. Okay. And another area that I wanted to talk to you about that I know you feel a lot of passion for is the lipid. And what is lipid, and why are cardiologists called to manage lipid?
So lipids are just another term for the fats that run around in our blood that are transported in our blood. So actually the fats that are transported in our blood are two. There's cholesterol and triglycerides. Both of them are lipids. Both of them are important. And there are many types, actually, of cholesterol. There's HDL and LDL and VLDL and IDL. The reason that cardiologists kind of get involved in this is that in a separate disease process from the rhythm issues we've been talking about is what we call coronary artery disease. So coronary artery disease is blockages in the arteries that feed the heart muscle. And those blockages are devastating. It's the cause of a heart attack, and leads to the need for stents and bypass surgeries and things like that. It's one of the major things that we deal with as cardiologists. Well, the underlying physiology of how those plaques occur involves cholesterol metabolism. So most of your cholesterol, most of your lipid, gets metabolized by the liver. So there's a receptor on the liver cell that the cholesterol lands on, and then it gets sucked into the liver cell and utilized in the liver. And as long as your cholesterol goes that way, it's not a problem. That's the way it's supposed to go, and everybody's happy. And basically, I might not have a job if it was the case. But Unfortunately for us, there is about 10 to 15% of cholesterol goes by what's called the scavenger pathway. Scavenger pathway for cholesterol is a process by which there's damage to the vessel wall, and part of the healing process is that certain white blood cells called macrophages incorporate themselves into the vessel wall and then start eating, if you will, cholesterol.
No, and I want you to hold that thought because we have to take a short break, and you're giving us a lot of great information, and I don't want to miss anything that you have to say, and I don't want our listeners and our viewers to miss anything either. So we'll be right back.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, I'm Deanna Barron, RN, with All County Healthcare. You know how I know that I've done a good job? We say goodbye. After you understand the medications you take, once you know that gaining 2 pounds in a day means you should call the doctor, when your wound is healed, when you can use your nebulizer all by yourself, when the goals that you and your all-county healthcare team of nurses, therapists, and aides established are met. We say goodbye. Very nice to meet you, and I hope I never see you again. And I mean that in the nicest way possible.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, my name is Patty Villa, and I'm filling in for David DePino, who's off this evening. Tonight we have Dr. David Perloff from Florida Medical Center. Dr. Perloff, thank you once again for being here.
Sure.
Before we went to commercial break, we were talking about lipids and how cardiologists help to manage them. So please explain to us, how does a cardiologist help people manage the lipids?
So fortunately, we've had a lot of breakthroughs in lipid management. As I was explaining before, the process of coronary artery disease is that cholesterol gets incorporated into the vessel wall and leads to plaquing of the arteries. And this plaquing restricts blood flow to the heart, and that restriction of blood flow leads to a lot of problems. It can lead to chest discomfort, where the heart is not getting enough blood flow, and so it's the areas that are fed by that vessel are starved for oxygen and nutrients, and they start to hurt, and that causes chest discomfort, or what we call angina. And if the blood vessel gets completely blocked off, the heart muscle that's fed by that artery will actually die because it can't live without oxygen and nutrients. And so that leads to what's called a heart attack. So that heart muscle will die and will never be able to pump again. So it's a central process of vascular disease is cholesterol. So one of the major treatments for prevention of heart disease, and actually treatment of heart disease, is to lower the cholesterol enough so that the plaquing can't occur, or occurs at a minimum rate. And the good news is that we've got a lot of very effective cholesterol medications at this point that do exactly that. So it's not just about reducing lipids, because there are medications actually that will reduce lipids, but don't prevent heart disease. It's actually about preventing events, preventing heart disease events. So I care less about cholesterol and more about reducing events, because I don't make just pretty cholesterol profiles. What I care about is reducing the likelihood that a patient is going to have a heart attack, stroke, cardiovascular death. And so we have a whole group of medications called statin medications that have been shown unquestionably to do that, to reduce heart attack, stroke, cardiovascular death. We also have ezetimibe, which is a different type of a cholesterol medication. It's actually a cholesterol absorption inhibitor, and that will reduce that. And we now have a new class of medications that are actually injectable cholesterol medications. That is a true revolution in cardiology, what we're doing now. And those are patients inject themselves like once every 2 weeks with these medications. They're highly effective, and they're great for people who can't tolerate other medications or can't get to their goal level with other standard medications. And we can get them very, very low on their cholesterol with these medications, and they're called PCSK9 inhibitors.
Now, besides the preventive, and I know that everybody's talking about that word, preventative medicine, what else do you advise your patients on, or people that you meet that ask you questions about preventative health or preventative medicine in cardiology when it comes to heart health?
So, most of the stuff that I would tell you about is really pretty well documented. Certainly smoking is one of those things that is, really very, very bad player. It increases your likelihood of heart attack. It increases your likelihood of all cancers head to toe. And I think from a preventive standpoint, if you have one single thing, and I tell this to patients all the time, if you tell me, you don't care what I say, you're only going to listen to one thing that I tell you, I would say the absolute number one thing that you need to do is to quit smoking. That is the single healthiest thing you can do for yourself. It's such a bad player in heart disease. Secondarily, I would say, there are a few things that are very important here. A lot of people come to me and think that I'm going to talk to them about their weight. I will tell you, it's very interesting. I really don't talk to people about their weight for the most part. And the reason is that if you look at the correlation between weight, or I would even go so far as to say obesity, and this even goes to the point of morbid obesity, and you plot that versus mortality or morbidity, meaning death or bad things happening, stroke and heart attack and things like that, there's really not a good correlation there, okay? So that if, in fact, there's something called the obesity paradox that a lot of people don't know about, that if you take people who have cardiovascular disease, one of whom has ideal body weight and one of whom has obesity, or even, like I said, morbid obesity, severe obesity, it turns out that the person with the obese person will actually live longer. And this is a true paradox we see in cardiology, and it's not something we've seen once or twice. It's shown in virtually every study we've ever done. What it turns out is, and let me kind of take a step back, nobody really knows why that is. There's a lot of hypothesis out there as to why this obesity paradox exists. But what I will tell you is the thing that is more correlated and that with morbidity and mortality, and the thing that I spend more time talking about in my office is actually aerobic fitness. Okay, so that's what's really important. If you look at the correlation between aerobic fitness and morbidity and mortality, it is a very direct correlation. So when somebody comes into my office, I do everything I can to assess where they're at from an aerobic standpoint, and help to educate them about the importance of aerobic activity. People ask all the time, what's the best exercise? Well, the best exercise is the one that you like, right? It's the one that you will stick with, because if I tell you the best exercise is running and you hate running, you're not going to do it, right? But if you happen to like swimming, or you happen to like tennis, or you happen to like jumping on a pogo stick, it's immaterial as long as you have that aerobic fitness. And so what I tell people is, I have patients who are very obese who actually are in good shape physically because they're capable of doing a good amount of aerobic activity. That person's going to do fine if you look at the numbers. Then I have some people who are skinny and they have horrible aerobic fitness, and they're not going to do well by the numbers. And so again, I don't spend so much time on weight. I spend more time on what are you actually doing as an individual to keep yourself fit.
And that's really good advice. And I want to segue into eating, because now we're in the holiday season and people are eating everywhere. I know I am going to different offices and all the different hospitals that I visit. What advice are you giving people during the holiday season of what they should be eating and what they should not be eating?
So we've undergone, that's a good one, because, all I can tell you is at my office, we have some really terrific patients and colleagues, and it's just it's unbelievable how much goodies end up there. And,
Yes.
it's all terrific stuff. So what I tell people is, I never tell my patients, you need to become a vegetarian, or you need to, have some kind of an extreme diet. I've always been a believer that there's really not value in being overly extreme. If I take somebody who is, eating hamburgers and steak and chips and, junk all day long, and they have a heart attack, and I try to make them into a vegetarian, I know for a fact that's just simply not possible. Right. So if I take somebody and ask them to make a small move, right, so that rather than eating hamburgers at every meal, you eat hamburgers at 3 meals and make a little bit better of a choice the other 4 meals. If I can get you to move a little bit, and then I take care of the rest with cholesterol medication and other things that I can do, I think I have a better chance of really keeping you on target, right? And then once you're eating hamburgers 3 meals a week, and you say, I can kind of live with this, if we say to each other, okay, well, let's maybe go down to 2 days a week for hamburgers. What do you think about that? And slowly move towards a process that is going to get you where you want to be. Again, we've got really great modern medicine. So I think eating is important. I think it's very important to minimize carb intake. Carbohydrates are anything white, basically. Sugar, pasta, bread, potatoes, rice, the things that you crave, right?
Right.
But if we can minimize our carb intake, we made a big mistake, and when I say we, I mean we in the healthcare profession, a lot of years ago, when we sort of had this food pyramid that was based in grains and things like that. And what ended up happening was that contributed to a lot of diabetes and a lot of sort of truncal obesity, and what we call the diabesity epidemic. And we're a lot wiser at this point. We really recognize that there are healthy fats. We went sort of to this high carb, low fat diet, and that was just not functional. It actually increased diabetes, worsened heart disease, and things like that. And so we're a lot more smart now, where we recognize there are healthy fats, and that meats and legumes and things like that are very, very good for you. And we try to minimize the carbs. More of a Mediterranean type diet is actually the best. Obviously, during the holidays, I mean, what are you going to say? I think eating is such an important piece of what we do. It's part of family. It's part of being together. I usually tell my patients, try to use some moderation, but don't make yourself miserable and enjoy yourself during the holidays.
And let me ask you, I mean, we talked about the eating, the exercise, we talked about AFib, lipids. Do you see patients in your office that's once they get all of that combination in a normal level, that you've been able to wean them off medication?
So what I will tell you is yes.
And I'm asking that because, there's a lot of people that are on medication that want to try to be able to eliminate certain medications that they take.
Right. So what I will tell you is there are plenty of my patients. Listen, as a doctor, I spend my whole life giving people medication.
Right.
I am way happy to stop medication. It is a celebration when we can stop meds. What I will tell you is it is uncommon that patients are able to do the amount of work that they need to do to get off of medications. Let me kind of take a step back. So if you look at hypertension, right, the lifetime risk for hypertension in the United States is 90%. we have a 90% chance of requiring antihypertensive medication in our lifetime. And as we get older, our blood pressure goes up. It's just a factual thing. So the likelihood that, that people are going to be able to exercise their way out of hypertension is highly unlikely. I mean, most of what I deal with, most of what I fight is not lifestyle stuff. It's actually genetics. We're really pre-programmed. And so, I get somebody who comes into my office who's, 500 pounds and has a blood pressure of 140/90. I'm going to tell you, yeah, you could probably diet and exercise and, get down, you could lose 30 pounds or 40 pounds and your blood pressure would probably come down fine. But if you come into my office and you're mildly overweight, maybe a little chubby, and your blood pressure's, 180/105, the likelihood you're going to get there with diet and exercise is next to nothing. So, and that scenario is way more common than sort of the other scenario that I was talking about. So what I would tell you is, yes, I think as physicians, we're obligated to use meds simply because most of what we're fighting, patients are unable to get where they need to be. But we are always happy and ready to stop the meds when we can. I want to talk about another group of folks because one of the things that we're very clear about is patients who have coronary disease. Mm-hmm. I get a lot of them coming into my office saying, well, I don't want to take a medication for my cholesterol. You need to wrap your head around the fact you need cholesterol medicine. Whatever your cholesterol is, if you've laid down plaque enough in your arteries to require a stent, that cholesterol is too high for you. And you're not going to be able to take care of that adequately with cholesterol, with diet and exercise. And that has been shown convincingly over and over again in excellent scientific studies. So what I would say is, yes, we love to get patients off of medications. Yes, I have success stories. I've had folks come to me and, be very heavy and either get a gastric bypass or are able on their own to lose 50 to 100 pounds and I've been able to take them off of medications. And that's a celebration,
Mm-hmm.
Unfortunately, it's extremely difficult to maintain that. Our cure rate of obesity in this country is worse than virtually every single cancer we have. So, again, not to be negative on it, it's just from a very practical standpoint. I've seen very few people that are able to maintain that.
Right. I know you have a passion for your profession, for being a cardiologist. What was it that inspired you to study cardiology and become a doctor?
So I had a very unique childhood. My father was an engineer, a civil engineer, and at 40 years old, he went through a midlife crisis and decided he wanted to go to medical school. So the family, we moved to Cleveland, and he went to medical school. I was 11 at the time. And so through my sort of more formative years, I had the opportunity to watch my father go through medical school and then go through residency and fellowship. and he would often take me to the hospital and show me the dissection lab, the cadaver lab, and all the crazy things that he would do. And he would talk about all the interesting things and patients and different folks he would take care of. And it was fascinating to me. And and so when I went to college, I was convinced I wanted to be a doctor. But I made the decision that if at any point that I decided that I really didn't want to do that, then I would choose a different career path. And as I got more into it, I got more and more passionate about it. And then cardiology, my father was a pediatric intensivist. He did pediatric intensive care, which is completely different than I do. And but when I was when we did the class on cardiac physiology, I was absolutely fascinated. It was so interesting and almost intuitive to me that it was very funny. All of my classmates knew I was going to be a cardiologist before I knew. And I just loved it. And so when the opportunity arose, that's what I decided to do. But it's such an amazing profession. I honestly couldn't do anything else. It's such a privilege to be able to have something that you look forward to doing what you do. Because I go home at the end of the day and I'm tired, I'm exhausted, but I never can feel like I haven't made a difference. I always get to feel like I do something important.
Right. And let me ask you, because this show is called You and Your Doctor, and a lot of the patients and the people that are watching like to know, what do doctors do when they have some time off? So what is it that you do for fun and what you do when you have time off?
So I'm kind of a high energy guy. So I like to go skiing. I actually go heli skiing. I love to golf. I have a 4-year-old and I have a 12-year-old, and I love spending time with them. That's one of my very favorite things to do. And I love to travel. I like to take the kids to interesting places that they'll be able to tell their kids about. When I was young, my folks traveled with me and gave me a knowledge of the world as much bigger than just our backyard, and get to explore different cultures and different ways of thinking, and that's one of my very favorite things to do. And then I also like to scuba dive. I like to fish. So I have a lot of varied interests, and anything else that's high energy and exciting.
Well, wonderful. Well, Florida Medical Center is very, very lucky to have you. Thank you for all that you do for our patients at Florida Medical Center. And have a good evening and happy Hanukkah. Thank you for being with us tonight.
Thank you so much.
We're going to take a short break, and we'll be right back.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home. But if you do, tell your doctor, I want All County Healthcare.
All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision and only your decision on what healthcare agency you use. Call today. All County Home Health Care Inc. at 954-717-7027. License 200999096. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hi, my name is Patty Villard. I'm filling in for David DePino. We are on You and Your Doctor. This evening we have Monique with us, and Monique is with All County Healthcare. Good evening, Monique.
Hi, how are you?
Good, how are you?
Good.
Wanted to ask you, what is All County Healthcare, and what is it exactly that you do?
Okay. I am a rep for All County, which is a Medicare certified agency. We've been sponsoring You and Your Doctor on the show, bringing specialists in your area to educate you. We've been providing home health services since 1990. We are located in Miami-Dade, Broward, and Palm Beach counties. And we, after illness or injury, if you need nursing, speech therapy, occupational therapy, social work intervention, physical therapy, psych, nursing, or respiratory care. We also do wound care or IV antibiotics. We have nurses that come into the home to provide all of those services.
So you are like an umbrella with all those services underneath that people can come and find you and ask for your help.
Right.
And what is the process to obtain those services? Because, you know, sometimes people go through such a hard time trying to navigate the healthcare system.
Of course.
And they need help. So what advice is it that you have for the people that are listening for us tonight?
Well, for everyone, the most important thing to know is we provide Medicare home care. But for Medicare patients, it's the patient's choice what exact company they want to use. So if a patient were to go to their doctor and say, I choose All County, they can and will use the company of their choice.
And what advice do you have when people come in? They have to filling out the paperwork can be overwhelming.
Of course.
Do you have social workers there that can help?
So we kind of simplify all that for you. So how it works is the patient will go directly to their physician, whether it be internal medicine doctor, orthopedic, podiatry, and they will, if the doctor, if they don't know of a company, the doctor will provide a list for them. But say they wanted to use All County directly, they would tell their physician, this is the company of my choice I want to use for my home care. The doctor would write a prescription, and then they would send that over to our office. And then from there, we staff the case, whether it be nurse, physical therapy, like I said, occupational therapy. And we have a nurse that does a start of care. She goes into the home, and we see exactly what the patient's needs are, and we communicate with the doctor. And
how long can that entire process take?
Well, the nurse, usually when the doctor writes the prescription, we have 24 to 48 hours for the nurse to go into the home to do the start of care. And after that, based on the patient's needs, if they need physical therapy, the doctor writes how many days a week the patient needs it for. And the cert period's 60 days. And if the patient meets their goals, they'll be discharged. And if not, we recertify them and have the nurse come out again.
And I know you have a lot of people that are happy with your services.
Yes.
Can you share a story or two?
Yes, of course. Well, we are the only company that has exclusivity with the IPV machine for COPD, asthma, bronchitis. And we had a patient, I want to say he was in his 90s, who was able to swim again, we even received a letter that he was able to make love to his wife again. So it's just, the results have been excellent. And it's also been proven to reduce readmissions in the hospital. And
which is very important.
Yes, exactly.
I know that we were talking earlier and you work in the Broward area. can you take me through a day in the life of Monique? Tell
Yeah.
me what you do during the day to make it all happen and make all the pieces come together.
Yes, of course. So I've been working for the company for 7 years now. So a lot of the current accounts I have, I revisit. They send me patients, and every time the doctor sends a patient, you have to follow it through with paperwork. So it's a lot of meeting with patients. I'll go to rehab facilities, nursing homes. We're very hands-on at our company, so we meet all the patients. We keep in touch with them. It's also trying to establish new accounts, so meeting with hospitals, new doctors' offices. It's like a revolving door, but try and get the name out there and establish as many accounts as we can.
And how did the company start? I know you mentioned you were there for 7 years. When did the company start, and how did it get its beginning?
It started in 1990. My boss, Lou Biazzi, and his partner, Cynthia. His dad was sick with Alzheimer's, was it? I believe so. Yeah. And then he just wanted to help other patients throughout and just
to help them feel
Exactly.
navigate
yes.
the healthcare system.
Exactly.
Yes, which can be very complicated.
Yes.
And I just want to remind everybody that's listening to us and watching us that if they want to get a hold of All County Healthcare, they can also call Maddie at 1-888-717-7170. Very important, because all of us are going to go through this. And I'm sure you've heard the stories, when we have loved ones that need attention, that need special care. What is it when you're confronting a family that is going through a difficult moment?
No,
what is it that you do that you can help them so they can feel better?
No, of course. Like I said, we'll communicate directly with the family members. I also provided these services through our company for my family. So I kind of try and explain to them how it's more of a mom and pop type family kind of business, as opposed to there's other companies that are more corporate and not as hands-on. And I keep in touch with them throughout, as is everyone else, and we try and make them feel as comfortable as they can with the process.
Right. And you had mentioned, you have a relationship with the hospitals. So how does the relationship with All County Healthcare and the hospitals work?
So, like I said, we've been in business since 1990, so it's a lot of, we have so many relationships with doctors throughout. So a lot of hospitalists in the hospitals or case managers, we kind of know so many people throughout the years. So it's just word of mouth and us going into new offices and just
we're
seeing everyone we know.
We're in the holiday season.
Of course.
So what stories do you have? What testimonial stories do you have during this time that you can share? Of people that you've met, of people that perhaps, you took care of, that are so, like you mentioned, the 90-year-old gentleman who is back swimming and happy with his wife.
Right.
What holiday story can you share with us that's heartwarm? Do you have one recently of a patient that you met, since you're out and about and you're meeting different people?
Yeah, of course.
Do you have another story that you can share?
I have a patient too, because we have the private side where we also do live-in aids.
Yes.
I have a patient who was referred to me from my grandmother, and he wasn't walking well, and I had referred an aide over to him who's been helping him tremendously, and he's up and running and right before the holiday season. So
and I think it's really important what you mentioned, that you have referred family,
of course,
to the company that you work for.
Of course.
Your grandmother has referred friends because they trust in the care that you're giving, all the patients and all the families that are coming to see you.
Of course.
And I want to mention that number once again. If anybody has any questions, this is really important. All of us are going to go through this one time in our lives or through another of taking care of a family member or helping a family member that needs help. You can call 1-888-717-7170, and you can ask for Maddie Kaplan, and she'll be happy to give you information. And also Monique, who is in the community as well, meeting out there, meeting you, meeting the doctors, going to the hospitals, meeting patients in order to help the community navigate through the healthcare, which sometimes can be a bit challenging.
Of course.
What other services do you offer? Because you mentioned, the live-in, you mentioned the therapy. So just so people have an understanding.
Yeah, of
because
course.
unless you go through this experience
Right.
of taking care of a loved one or
Right.
helping a loved one, you really don't understand what it is that you're going to be going through.
Of course.
So what other services do you give?
So we do anything from speech therapy, occupational therapy, social work intervention, physical therapy. We have psych nurses, respiratory therapy, wound care, IV antibiotics. So any of those services, we do have nurses to take care of patients.
And out of the services that you mentioned, do you have any testimonials that you could share of successes that you've had with people there?
Yeah, of course. I've had patients who, it goes for all. If you have surgery, we have so many people who use our therapists, and we have had excellent care that will help them up and walk again. Even my grandfather, before he passed years later, but a couple years ago, he started on service with us as well, and he had pain in his sciatica, and we had a excellent physical therapist in the area come out and help, and he was able to walk. He was paralyzed in the whole left side of his body, so they helped him move his hands here and there. So we definitely have therapists to help.
Yeah, and
those areas.
working with therapists is so important, especially when one needs them.
Of course.
I want to thank you for being on.
Thank you.
I want to thank you for for giving us the information. We're going to take a short break, and we'll be right back.
Thanks.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, But if you do, tell your doctor, I want all county health care.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Good evening. My name is Patty Villa. I was the host tonight for Dave DePino, who's off this evening. Thank you for listening. We want to thank David Perloff, Dr. David Perloff, once again from Florida Medical Center, who spoke about matters of the heart and how to take care of your heart and what to eat during this holiday season. And remember, much exercise. We also want to thank our sponsor, All County Healthcare. Remember, if you need information and you want to talk to Maddie, call her at 1-888-717-7170. Happy holidays and Happy New Year, and have a fabulous 2018.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests, and callers, and not necessarily